doses of Jaya Mangala Rasa for pneumonia in children?
Yeah, Jayamangala Resa, the adult dose is 60 milligram per day. So you can split the dose according to the child's age. So I can think the pneumonia 20 milligram to 30 milligram is a sufficient dose to a child. You can use it in that dose. But you
Uh,
have to restrict the use for a certain days, not more than 2 weeks you have to use. Long term use is not advised.
Sir, next question. Can we use Kasisa Basma in menorrhagia conditions?
Yeah, but the thing is that many of the times Kasisa when used can prompt more uterine bleeding. So it is better to use Kanda Basma instead of Kasisa there.
Sir, next question. Sir, some patients have HB level normal but iron deficiency. How to understand this pathology according to Ayurveda and which kalpa can we use?
Once more, can you repeat the question?
Yes, sir. Sir, some patients have HB level normal but iron deficiency. How to understand this pathology according to Ayurveda and which kalpa can we use?
Yeah, that's a very good question. Many of the times, these biomarkers and bioinvestigations, they are only aid. So I think there is a problem with the metabolism of iron. So for that, we have to correct it. So not by supplementing it, but to correct the metabolism. So the best way to treat is with the kalpa of Rasakalpa you can use is Arogyavardhani since it corrects the Jadaratni as well as the Datarni. So the metabolic error will be corrected and by the use of 2 to 3 months along with Dadimadi Vida you can use it and the iron metabolism will be corrected.
Sir, you had mentioned Surya Ksharan in Ashmari Chikitsa.
Yeah.
So, what is the dose and Anupana, sir?
Yeah, Suryakshara Kasisa. It's a combination which contains Suryakshara and Kasisa. Why I have told it in Ashmari is that the Suryakshara is Vedana. But many of the times you cannot procure. Uh, you should make it. If it is not available, you can again use instead of that Sweda Parpadi. It also contains the Suryakshara. So why Suryakshara? It is highly Vedana and it can make the Ashmari Bhedida. It can crack the calculus so that it can go through the urinary tract. The urinary tract, you know, it is 4 millimeter in diameter and you have to crack the stone so that it will go out. If you give this Sweda Parpadi or Suryakshara Kasisa, you can see many of the patients picking these stones with them and coming to you. So that's the case. And the dose will be the for Surakshara Kasisa 100 mg is enough. But when you use Sweda Parpadi instead, you can use up to a dose of 500 milligram to 1 gram even. It is very safe. Only 3 salt are there. So 500 milligram to 1 gram you can use the dose of Sweda Parpadi when you are using it. For Surekshara, it is 100 milligram, but it is not available in the common pool. That's why you can use instead Sweda Parpadi with a dose of 500 milligram to 100 milligram, which contains Surekshara.
Okay. Okay, sir. Sir, next we have a small case. Patient aged 37 years, female, history of typhoid fever 3 times. After relapsing fever, her thyroid titer always positive and complained of Sarvanga Daha along with maxillary polyp. Left eye lacrimal duct swelling. Kapha Vataja symptoms mostly. Ketu Sankarpajanya. So what can we do in this case, sir? Any?
Yeah. This case in which we can see two or three things we should pick up in the pathology. First one is there is a dhatu lina avastha. It has having a chronicity of infection, and the dhatu lina avastha and vishama jara. So for you have to pick up that pathology. Along with that, some Vitiga problems, some of the infections get there. So the some problems with the in this patient, some of the problems with the lymphatics also. So you have to select one such medicine to target the lymphatics also. So for that, the Arogya Vardhani is a best choice along with the Kashaya Kirada Tikta Kashaya. Tikta Kirada Tikta, which is mentioned in Kushama Jara of Charaka Samhita. You can take that Kwada as Sahabana along with Arogya Vardhani Rasa. Along with Arogya Vardhani Rasa, you can combine Lakshmi Vilasa Rasa. Naradiya Lakshmi Vilasa Rasa. Both taking the infection. And again, one more medicine you have to use to correct the this lymphatics for this patient, that you can use Nityananda Rasa, which is said in Slipada, and it is directly it will act in the lymphatics, the Rasa Sadhu, and it will be corrected. So you can use Aragyavardhini and this Naradiya Lakshmi Vilasa Rasa combined two times a day, along with the Nityananda Rasa 100 milligram per day, and you can use a Kashaya, a Sahabana, which is told in Charaka Samhita, Vishama Dhadu, Vishama Jara Chikitsa, with the Tikta Kirada Tikta. So that Kashaya Pada can be used as Sahabana. These can be combined in the treatment.
Okay, sir. Sir, one of our participants would like to talk to you.
Yeah.
Hello, sir.
Yeah.
Good evening, sir. I have shared now the case now. Sir, she has a pituitary gland. Pardon, sir?
You are from which place?
Bangalore, sir.
Okay.
Dr. Ujwala here, sir, from Bangalore.
Yes.
Sir, this case, my diagnosis after this case was a Shotha, because all pathology is gone to Shotha, because lacrimal glands swelling again, maxillary polyp, and
Yeah.
again she had this pituitary gland swelling also, and I thought it is Aurojanya, so that Hastapada Daha is not proper pitta, it's because of Aurod of pitta. So this will be correct, na sir? Means if we give this.
Yeah, it will be corrected.
Oh, okay, sir. Thank you.
Yeah, it will be corrected. You can contact me after the use of 2-3 weeks. You can contact me.
Okay, sir.
It will be. It will take 1 or 2 months.
Okay.
After 3 weeks, you can contact. You can change some medicine according to the condition. Yeah, yes.
Sir, can you please tell us your number so that I can share it with everyone?
9446174 9446174 So these are the things which I have gained from the practical application, not only from text. So I am confident to tell you that this will work. And if you have doubts, you can contact me.
Sir, few more questions are there. Can I read?
Yeah.
Sir, in kids, which Rasakalpa we can use in recurrent viral high fever and to increase the immunity also?
Yeah. These 2 or 3 things which can be applied, but we should personally each
चटनी देना और
cannot
अच्छा,
say
दुकान से ले लियो।
one, but Rasa Sindhura is
ज्योति।
one thing which you can use, and along with that you can use this Uramarunu Guliga. Masuri Guluga is also there, which is in Arogya Kalpa Primam. It is very specific, Masuri Guluga, and it will Resisindura in small dose according to the age of the child. I have shown about the dose which can be used in each age. So you can select that. It is safe from a good source. If you select, you can use it. Along with that, this Masuri Guliga you can use, and this Uramarunu Guliga also for the child. So it will be corrected.
Sir, Kachura Swarsa means what?
Kachura means shadi.
Study. Sir, what is Shilajit? Shilajit.
Yeah. Shilajit. Actually, Shilasat it is a local term which is said for Godandi, incinerated Godandi in Kerala. And many of the time it is labeled as Kanmada Basma. Many of the pharmacies, Kanmada Basma, they say Kanmada Basma, but it is actually incinerated Godandi, not Gomutra Gandhi Shilajit. This incinerated Godandi.
Sir, dose of Trivanga Basma in diabetes mellitus.
You can use up to 200 milligram per day.
Sir, there is a question. Can you suggest any authentic Rasa Aushadhi pharmacy or manufacturer?
I used to use from if the doctors are in all India basis, I can suggest Doodh Pabeshwar, Sri Doodh Pabeshwar. They have the products are standardized, no threat of toxicity. Then Baidyanath, Kashmir, so many pharmacies are there. It can be used. And in Kerala, we have some Siddheshwara in Palakkad. Then in Tamil Nadu, there is a Incops Adayar. Bombay, Sri Dut Pabeshwar is there. They are distributing all over India. Baidyanath, Kashmir Pharmacy, all these are good.
Sir, another one case is there, sir. Patient age 40 years, female, with weight 90 kgs, with recurrent Mutra Ashmari, 90 kg weight. With recurrent Mutrashmari, iron deficiency with fatty liver changes. Which Rasakalpa can be used? And the doctor thinks that it's related to more Kleda and Yakrut Vikrati. Santarbhajanya Hetu.
Definitely. Two or three things which we can look into that is actually it is what the doctor thought is correct. You have to make specific choices for that, and the specific choices which is working there will be two or three things. Shiva Guliga. Shiva Guliga is best for all these as a stula. Shiva Guliga is one which is told to Ganapati, advised to Ganapati by Lord Shiva. So if you see the picture of Lord Ganapati, you can see it's stula, without it's a metabolic syndrome. So in order to avoid the risk of that, Shiva suggested Ganapati to use this Shiva Guliga. And the main content is Kanmada, Gomutra Gandhi Shilajiti. And it is best. So you can use the Shiva Guliga there. Along with that, Arogyavardhani can be used to correct the liver. And you can use the Varnadi Kashaya as Shahapana. It's good for that.
Okay, sir. Sir, Hema Garbha Potali Rasa dosage and when to use in emergency.
Yeah, Hemagarbha Potali is actually containing gold, tamra and all, and kajali. It is made cooked in 12 hours in liquid sulfur. So it is a potential one. So for prana vaigumya, when all the central nervous system gets affected, the all commands are from brain. So at that instance, the patient is going to unconsciousness, fainting, and all, and even some episodes of even before a cardiac arrest, you give it right away. Sometimes we can prevent that in those emergencies, and in brain degenerations, in cancers. So it has a three or four branches we can apply into three or four different streams, and it is a having potent rasayana. So especially it is basically for making the prana vaigunya proper. Prana is controlling everything. So you have to make it proper. That's why it's good for. And same time, Siddhamagarda Hemagarbha bottle is not the, even if it is not that much potent as Potali, you can use Siddhamagarda. And the Hemagarbha bottle, actually it is being grinded in a stone along with Anupana and licked to the tongue. In many of the cases, the patient will be unconscious, so that we can lick into the tongue, and from the tongue, it is being assimilated like aspirin, which they are giving. It is being uh, assimilated, and within minutes, it will get into action. So the dose actually eight cycles around that stone to rub. It is said like that, but actually, as a practical application, I see almost it can be given as the dose of Basma, Suvarna Basma, like 50 milligram you can give per day. This good.
Sir, which Rasakalpa can be used in Nidra, Nasha, and headache in old age due to anxiety and stress?
Definitely, Manasa Mitra Vadagam, which contains gold. If it is properly prepared, it is excellent in this condition. But unfortunately, many of the pharmacies, they are not adding gold basma, so it is not that much useful. But you can select a source, and when it is properly prepared, this is the best thing which you can give in this condition. And you can make a leba or a tala murda daila with gairiga. Gairiga with you can make a paste of gairiga in shira and apply as tala over the head scalp. It is having good result. And you can also do some dharas like tatra dhara along with, or taila dhara, according to the condition of the patient.
Sir, in Pada Daha, which is mainly due to Vata Pittaja condition, what can we do? Pada Daha.
Yeah. Pada Taga, two things is very important, mainly because of the neuropathies it happens. And the best one is Shadadauda Krida. Shadadauda Krida can be applied externally. It is very specific and it will bring immediate results. And the Gairiga can also be applied as external leba. One time Gairiga leba, one time this. It will bring good results.
Sir, in gallstone colic, what should be given in an emergency pain, and is any Rasakalpa for gallstones?
Yeah, good question. I, I, I have derived some of the results in gallbladder stone with the use of combining Sweda Parpadi with Kasisa. So combined Sweda Parpadi and Kasisa Basma, and used along with the Saptasarang Kashaya as Sahajana to pacify that, and to break the stone. It is useful. By 3 or 4 months, it gradually decreased, and polylithiasis went. But acute pain can be controlled by using 100 milligrams of Padiga Basma along with 100 milligrams of Tangana Basma to combine both and give it in hot water. The pain will be controlled.
Sir, in hypertension condition, what can we give, sir? Which what
Hypertension.
hypertension?
Yeah, it is a general question, and we have to think about the patient, specific to the patient. As a general, Prabhakara Vadi is one which is working in many of the times in hypertensions. Prabhakara Vadi is doing a good job, but you have to be specific to the need of the patient. So select the medicine according to his need. Actually, hypertension is a symptom, not a disease. So you have to take a uh, history, medical history of the patient, and according to the need, you have to select. Sometimes Manasamitra is working, sometimes Prabhagaravadi is working, sometimes this one Padyakshadatryadi is working, sometimes Punarnavadi is working. So you have to select the medicine according to the need of the patient. But in general, Prabhagaravadi is one choice which you can make.
Okay, sir. Sir, use of Loha Basma in CKD for anemia, is it safe or not? Chronic kidney disease.
No, that's you have to be very careful in kidney disorders. Even in Mutraghada, Rasa Sindura is told, but Loha Basma you have to be very careful, and the processing should be very fine. Unless and until you are not, you should be clear about its genuineness, you won't use it. Better to use Shilajit than Loha, and Shilajit you can use as in the form of Shiva Gulija along with Vastyamyandaga Vadha. You can convert Vastyamyandaga Gruda formulation to Vastyamyandaga Kashaya. And Chandraprabha is also a good choice. So you can use Shilajit more than Loha. It's more safe in this condition.
Sir, can you please explain the difference between Lakshmi Vilasa Rasa and Naradiya Lakshmi Vilasa Rasa in treatment aspect?
Yeah, Naradiya Lakshmi Vilasa Rasa is actually which is told in Rasayana Prakarna of Vaishyaja Ratnavali. And even though it is told in Rasayana Prakarna, it is useful in controlling all infections. You can make use of Naradiya Lakshmi Vilasa Rasa in all types of infections, since it contains Abraga Basma, double the dose of other medicines. In the combination, the Abraga Basma in Naradiya Lakshmi Vilasa Rasa, 2 times Abraga Basma is taken to the ratio of Kajali. So it is a very good combination of Abraga and Kajali. Along with that, other medicines are added to fortify it. So it is a excellent Rasayana, excellent Vajigarana too. But if the patient gets Bela, all the infection will go away. So you can use it in all infection. But Lakshmi Vilasa Rasa, another yoga, which is not Naradiya, can be used in Kasa. Kasa Prakarna it is called. That is specific word.
Okay, sir. Sir, a 50-year-old male patient with Grahani with fissures. Can you please suggest any resolutions?
Very good, excellent. 50-year patient with Grahani
Grahani with fissures. Fissure.
fissures. Yeah, The fissure is actually a complication there. It's an upadrava. Actually, it is because of the grahani happened. This is actually the complication of ulcerative colitis. So you have to treat that grahani well. Maybe the patient will be having blood along with the stools. Is it so? Ask him, ask him whether the patient complains of blood through stools. Is it there?
Dr. Vishakha, you can unmute and speak.
Hello, good evening, sir.
Yeah.
Yes, sometimes he does complain of blood along with stool.
Yeah. So you have to first of all control that. For that, the best one is to make a modification there. You have to treat it as a Vrana and Shobha. There is a Vrana in that area. Ulcerative colitis means there is a ulcer in the colon and it bleeds. So you have to cure that first of all. And the inflammation is there along with that. So what you have to do, and the liver functions may also vary. You have to make a kashaya in which you can add tribhala. Tribhala is the best agraushadha for wound healing. So in grahani the best kvadha is kaida vyadi. So in that you have to add only this haridagi is there, not tribhala. So you have to add tribhala to kaida vyadi, and you have to give him 2 times a day. By that the ulcer there will improve and the bleeding will stop. And along with that you have to give Shangavasma, not Kasisa, to raise the HP. You have to control you have to make a balance in the liver function. So sometimes he may have some bile vomiting in the he may have. So you have to control with the Shangavasma you can control it. Along with that you can use as an external application, you can use Jatyadivrida to address the fissure. You have to use Jatyadivrida to address the fissure. So by 30 days you can shift from Kaidaryadi to Chiruvilluvadi Kashaya so that it is properly addressed. The Abhana Vaigulya there will be properly addressed. You can use Arogyavardhani in the entire course. This is a regimen which can be followed, and if you get Ajak Shira, it is more good in the diet. If you can introduce Ajak Shira, it is very useful. So
Yes.
this pattern can be in a similar patient. I got a very good result in which the patient lost 1 glass of blood every day, and his HB was 3 when approached me, and I have not given Kasisa Basma. Kasisa increase HP, but we won't treat like that. We should be able to correct the underlying pathology. Here the underlying pathology is the Vrana and Shobha there in the ulcer, and as a result of that the complication of this all this will occur, including the fissure. So you have to first of all address that ulcerative colitis, and along with that you can you can address it with an external application with this Jatyadivrida in the anal region externally, and after that you can switch over to Chiruvilluvadi Kashaya and even this Gulgulu Panchadala Churi.
Yes, thank you very much.
Sir. Sir, in enlarged thyroid gland, after giving Kanchanara Gugulu, Varanadi Kashaya and Kubera Raksha Vati, still not getting result. In some patients, respond a little but totally not getting results. So, which Rasakalpa can we give in thyroid gland enlargement?
Yeah, that's a very good question. And many of the patients respond in different manner. One or two things you have to check is the diet pattern which you are giving, and some of the things you have to cut down, like cabbage. All those things should be cut down. Cabbage cannot be used, and also some of the things you can do is that it is actually you can use a little bit cotton medicine like Nityananda Rasa and Tamra. When you combine Nityananda Rasa and Tamra at a dose of 100 milligram of Nityananda Rasa and 20 milligram of Tamra, if you use it for 1 or 2 months, it will definitely you can get the reduction in the size of the gland. Okay, it's more potent. Sometimes some more potent medicine is needed. And also this Kanjanara Tot, if you collect the Kanjanara root bark and make a decoction with that, it will be very specific along with this.
Okay, sir. Sir, which Rasakalpa can be used in male infertility if the FSH is high and having no sperms?
Yeah, very good question. Definitely Abraga Basma. You can combine Abraga Basma and Trivanga Basma with a dose of both 100 milligram each, and you can use it. It will be working because it it will be controlled even from the brain centers.
Okay, sir. Sir, in myasthenia gravis condition, ptosis if it is there, which kalpa can we use?
So that is a type of Akshayavaga Vada Vyadhi, and you can use Vada Vidvamsana Rasa and Mahavada Vidvamsana Rasa, and it can be accompanied with this Maharashtradi Kashaya or Dhanadhanadi Kashaya. You can use one of the decoction, Maharashtradi or Dhanadhanadi as a Sahapana. You can use Vada Vidvamsana or Mahavada Vidvamsana you can use. Along with that, you can also use Chira Bala or Dhanandara Avarti along with the Yogaraja, Mahayogaraja will do it internally. Do a Tala with Dhanandara. Murda Dailas are also very important in this case. So divide it into two. In the first stage, you have to also take care of the nerve supply and circulations there. Then the muscles and dhadus affected should be corrected.
Okay, sir. Sir, in diabetic peripheral neuropathy, which Rasakalpa can we use?
Yeah, very good. Diabetic peripheral neuropathy. This two or three things you can combine. First one is Trivanga Vasma is an aptly choice. 200 milligram of Trivanga Vasma. Sornamaladi Vasanda Visumagara Rasa. Trivanga Vasma and Shiva Guliga. This can be combined. You can use this Vishagadagadi as a Sahapana. It is good for peripheral neuropathy. Tuluji can also be used as a Shida Kashaya. You can make a Shida Kashaya. Just one handful of Guluji stem you can take. Just scrap the outer layer, make it into small pieces. You can Guluji stems in a 1 glass of warm water and then keep it for one night. You take it in the next morning, empty stomach, every day. It's very good. Along with Trivanga, this Sarna this Vasanta Kusumagara Rasa and Shiva Gulga.
Sir, which Rasakalpa in recurrent Shida Pitta condition and Darunaga?
Yeah, the Sangavasma is good for Dharunaga, it's external also. Then Shida Vitta, the best one. There is an external application also with this Spadiga Basma. You can fry, roast this Spadiga Basma, make it a Basma by simple roasting, make it into fine powder. You can rub the affected part with this Spadiga Basma. Along with Gairiga, you can combine. It is excellent in Shida Pitta. With that, you can use Amrita Rajanya Adipwada, which is explained in Shida Pitta in Sahasra Yoga. Internally, you can take Amrita Rajanya Adipwada and also Pravala Basma. Pravala Basma or Pravala Pishti. Pravala Pishti is more good.
Okay, sir. Sir, in diabetic patients with CKD on dialysis, can but Vasanta Kusumakara Rasa be useful as Rasayana?
This condition requires a lot of effort and we should be very careful, and you can use it, but the patient should be in your strict control with lot of diet restrictions. You can make some changes, but you have to be very careful. You can also try this Kanmada, this Shiva Guliga in this condition. It's good, along with Brihatyadi Kashaya. You can use, but the patient should be very much in control of diet. Already the things are going wrong. This liver and kidney got damaged. We should be very careful.
Sir, in hyperlipidemia conditions, what can we give, sir?
I used to use Sarnamarshika Basma, which is working in some of the patients. It is working. Then Aragyavardhani is another choice, and the Chandra Prabhagulika.
Sir, two more questions last. Sir, can you please tell us the indication of Godanti Basma?
Godandu is actually insulated gypsum, so we can use it in 3 or 4 ways. Godandu can be used in fever also. In all infections we can use Godandu Basma at a dose of 200 milligram to 500 milligram. Even in the migraine, you can use Godandu Basma along with the combination of Shira Shiladi Vadragasa. And again, this Mutra Krichra, Ashmari, Pandu, Kamala. In all these contexts, we can use it in a dose of 200 milligram to 500 milligram according to a suitable anupana you can select.
Sir, we get a lot of cases like with the history of steroid intake, lot of steroid intake in different conditions. So, which kalpa can we give to them as a Vishagna property?
As to
Vishagna property.
yeah, very good.
You know that steroid Vishagna.
Yeah, the most important thing is that for that Dushi Vishari Guliga is best one. Dushi Vishari Guliga. It's a combination in which the chronic poisons can be expelled out. Another one is this Arogya Vardhani, Mala Shuddhigari Nityam, Durdarsha Chudravardhani. And another one, you can have another good choice of Sanjeevani Vadi, which can expel these poisons. Sanjeevani Vadi. Villwadi Guliga, also good. Visha Villwadi, very good. And all these are the choices which you can use. And Pravala can also have a role in having some problems with steroids. Pravala Pishti can also be internally used.
Okay, sir. Sir, there's a Aushadha for headache in OPD level, other than Chirashula Vajrasa.
Pardon, Resaushadi for
For headache.
headache. Headache can be best cured by the combination of three. The first one is Patyakshadatrayadi, then Shirashudadi Vajradasa, and the third one Bodandi Bhasma. If you combine these three, you can have excellent result. No other need of that. Suvarna Muktadi is another choice which you can apply. So the first one itself, if you combine these three, you will have good result.
Sir, that's the end of the questions that has been in the chat box. And if any of our participants who wish to talk to sir, you may do so. Yes, Ujjwala, you can speak.
Hello, sir.
Yeah,
Sir, I don't remember the reference of this Suvarna Makshika in Nidra Nash.
yeah,
Uh, that Kalpa have been mentioned.
yeah.
So I don't remember the reference.
Ah,
So I think Nidra Nash is more related to stress and Majja was Roto
yeah,
Dushti.
yeah, yeah.
So it sharp. But Suvarna Makshika is a sharp. So how means I didn't get it.
Okay,
Can you
can you
Ujjwala, can you
raise
speak
your
and
voice?
louder?
Not audible.
hello, sir?
Yeah, yeah.
Sir, Suvarna Makshika is mostly Kapha Pitta sir, Kalpana.
Yeah,
So, and this is mentioned in Nidra Nash is the first yoga.
yeah.
So, how and Nidra Nash is related to moreover Vata Pradhana.
Ah,
So how to understand means I get confused to give this in like this patient. So
okay. Swarna Makshika, you can understand Swarna Makshika. It is a combination of two or three things. Do you know its chemical constitution is copper and iron, copper iron sulfate, CuFeS2. So it is
yes,
a mixture. So likewise, we have a mixed pathology. It is very useful. It it could bring in so much of circulation, blood circulation. Copper and iron. Iron increases the blood count, but copper increases the blood circulation. So it is useful to increase the blood circulation, and for the brain, if the circulation is increased, it is very excellent. So it is actually working in that sense. So it is the best Agra Aushadha for Staulia, but it increases the blood circulation well, and it can be used in Mudra Nasana Yoga. So that makes sense. And also you can see that Swarna Makshika is a substituent of Swarna Bhasma also. So that means it
yes,
can
sir.
have some effect in the neurotransmitters. That's why it is acting like that.
Okay. So it's mentioned with Kushmanda Swarasa, sir. So
Yeah.
only this combination I can give, or any other kalpa I have to use along with that in a Nidra Nasha.
My advice is you can use along with this Manasamitra Vadaga, a good
Oh,
one for taste. It will be better if you use.
okay.
And you can also put a tala with Beiriga if the patient doesn't have any cervical spondylosis.
Okay. Okay,
Okay,
sir.
fine.
Sir, and which kalpas we can means rasa kalpa safely we can use in kids?
In which
Kids means up to 14 years means from
kids? Yeah,
kids,
you
yes.
can use almost all Desakalpas. No, not to fear, but you have to decide the dose. That I have given that guideline how to use it in children. With that dose, that guidelines you can follow. Say up to 1 year, below 10 milligram. If you are using adult dose 125 milligram, below 1 year only 10 milligram can be used. Likewise, I have given a table in the presentation.
Okay, sir. Okay. Sir, and one more last question, sir. Sir, nowadays most of the kids getting pre-diabetes in smaller age. I have one kid 8 years old. So I have gave only triphala means normal this churna only, kashaya only. She
Yeah,
has recovered. So
yeah,
I
very
was
good.
thinking about before Arogya Vardhini, but sir, means I was confused. I should give or not. So
Yeah,
that's why I asked, shall we give Rasakalpas in like that condition?
yeah, Arogavardhani is a good choice which you can give. Nothing to fear about.
Sir, now she is okay. She has recovered.
So
So,
no need of that.
so no, for so as a rasayan, what kalpa I can give? She is 8 years old.
Yeah, as a Rasayana too, you can use either Chandra Prabha Gulya or Arogavardhani. Chandra Prabha as
For
a
how
coach
long, sir? For how long?
for 41 days or even 3 months you can conduct.
Okay, okay, sir. Thank you, sir. Thank you so much. It's a very wonderful session, sir. Thanks a
Yeah,
lot.
yeah.
You have explained each and every topic and patiently given our all answers. Thanks a lot.
Thank you, thank you. You can adopt it in your practice.
Sir, we have one more participant. Yes, Dr. Udaya.
Good evening, sir. Sir,
Good
do we
evening.
need to monitor RFT, LFT during this Rasoshita usage?
Yeah, if you are in doubt, you can monitor, no problem. Many of the times it will improve the liver function. If Arogyavardhani, when you purchase it in a from a good source, if you use Arogyavardhani, it will improve the liver function. Actually, I have 2 or 3 slides with some cases, and in which in a cholangiocarcinoma patient, when I have given Arogyavardhani Rasa and a Mandura Basma to that patient, by 1 month his liver function has become normal. From he had a bilirubin this bile 5 bilirubin has come to below 1 within 30 days, and LFT also become normal. I have witnessed that. So Arogya, it is Arogya Vardhini, not Arogya Nashini. So if
Okay,
you
okay,
make
sir.
it proper, it will improve your health, and your liver function will be more good.
Okay, sir. Thank you very much, sir.
Any other questions? Or else we'll wind up the session here. Yes, Ujjwala.
Hello, sir.
Yeah, yeah.
Sir, this is not related to any case and Kalpa, sir. Uh, Once we have a case, we will means first we take hetu everything history. Uh, what problem I'm getting, sir? After taking the history, I can diagnose, I can make the dosha dhatu. I will go till that, but when that kalpa decision comes na, I get stuck there because so many kalpa, so many churna
Yeah.
batti kuti. So this is very difficult.
Yeah, yeah. You have asked a very good question. I think many of the Ayurveda doctors are confused. We have a lot of choices. So by seeing the lot of only when the allopathy doctors, they are not confused. They have only some choices. But our system is very wealthy. So many choices. But out of that, you have to pick the right one. That make you a good doctor. That's why I am explained from the first slide itself how it can be used specifically. Likewise, these are examples. You can improvise in that aspect. By practice only you can
Yes,
improvise. By thinking only you can improvise.
yes. Okay, sir. Thank you, sir.
That is needed. The thing is that everybody is confused with lot of choice, not knowing where to use it.
Yes, sir. Yes. Thank you, sir.
Thank you. Dr. Jyoti, you can speak.
Good evening, ma'am. Good evening, sir. It is a wonderful session, sir. And we are very much blessed with Ayurveda map that